Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. This is of a very interesting case of a patient who is actually a Royal Marine commander. And they are regarded as an elite, highly trained force who are amphibious. So they have to deal with hostile land and water environments. And this particular patient was just returned from their training. They were stationed abroad, and as part of this particular training rotation, they were spending a lot more time submerged in water. And subsequently, they developed swimmer's ear. It's the first time the patient's ever had any problems with their ears, and it only occurred post-training. And when I was obtaining a history from the patient, they explained their current role, and being a Royal Marine Commando, they have to be trained with the most hostile of environments in the world. And this rotation, it sounded like a beautiful place actually, where they were undergoing their training, but it did involve spending a lot of time underwater. And so I spent a bit of time explaining to the patient what can happen if your ears are swamped with water, and how to try and prevent this from occurring, because of course going onwards as part of their training, and if they're ever stationed somewhere, they may again need to spend more time underwater. So water can affect your ears in a couple of different ways. The first thing it can do is it can macerate the skin, and this is what's happened here. So the skin cells that line the ear canal, they are epithelial skin cells, and they form the outermost layer of the skin that lines the ear canal, the epidermis layer. And these epithelial skin cells are what we call hydrophilic. They are attracted to water, and if you've got water in your ear and it's swamped in there and it's waterlogged, these skin cells will absorb as much moisture as possible, so they will overhydrate. And when the skin cells overhydrate, eventually they will burst. If you think about a water balloon, it can only take so much water before the balloon will burst, and it's the exact same with our skin cells. And when the skin overhydrates and bursts, the cell membranes rupture. They also erupt and burst, and it basically breaks down the skin layer. And this dead skin becomes very mushy, wet, just like in this patient, as you can see. I've removed the main occlusion. There was a big plug of dead skin. I've removed that, and all I'm doing now is spending a bit of time just trying to peel away this macerated layer of dead skin. Another thing that can happen if you get water in your ears, it can wash away essential moisturizing factors that are lining the skin in our ear. So earwax is made up of 3 primary ingredients. It's made up of dead skin cells, exfoliated dead skin cells. It's also made up of sebum. So sebum is a viscous, oily, fatty secretion from the sebaceous glands, which are attached to the hair follicles at the root. We also find it in our scalp, and we can find it in the ear. And the hair follicles, the hair strands in the ear, are located on the outer third. So we do get sebum in the ear as well. And also our ears secrete a less viscous, oily sweat, and they're secreted by ceruminous glands. So these glands are modified apocrine glands, so sweat glands, and they are more or less exclusive to the ear canal, the inner groin region, and also under our armpits. So contained in these fatty, oily, sweaty secretions are essential moisturizing factors which protect the epidermis layer of skin. So it protects water externally from entering the skin cells and getting absorbed by the inner layers of the skin cells. And these fatty oils and sweats also are slightly acidic, and they help to inhibit harmful bacterial and fungi growth. What these essential moisturizing factors also do, they also allow the skin cells to retain their natural inner moisture. So because it's oily and fatty substances, they are hydrophobic. So they help the inner skin protect the inner skin and keep them hydrated. So it allows the moisture to be retained. So these oils, these essential moisturising factors, eventually does form earwax. But earwax is, in moderation, a good thing. We all have it. And it presents itself in a thin veneer, a thin film, a coating that lines the ear canal and also the eardrum. And again, the acidity in these oils are designed to inhibit certain bacterial and fungal growth. The oily, fatty structure of these oils help to repel water from being absorbed by the skin cells, because we don't want them to overhydrate. And it also allows the internal moisture of the skin cells to be retained, so the skin doesn't dry and crack. When you get water in your ear, it can wash away these essential moisturising factors. So this little veneer of fatty oils is no longer present on the skin. Not only does that give premise for harmful bacteria and fungi to then colonize the skin and change the skin flora. So on our skin, it's got its own ecosystem. We've got loads of healthy bacteria and fungi. And if these oils, this acidity is no longer present, harmful bacteria and fungi can then colonize that skin. So the acidity helps to keep it at bay. But also, when you wash away these natural oils, the internal moisture in the skin cells is no longer retained within the skin cells, because this hydrophobic layer that keeps the fluid away from the surface is no longer there. So internal fluid in the cells, it rises to the surface and it evaporates. And that causes our skin to become very dry and itchy and flaky, again, like this patient. So quite often, if you've got an itchy ear, the rational thought is to get water in your ear to kind of hydrate it and to get it moist. But not only can it macerate the skin, but it can wash away the outer veneer of essential moisturising factors, which protect the skin from harmful bacteria and fungi, and also protect internal moisture from evaporating from out of the skin cells, causing the skin to become very dry and flaky. So in actual fact, getting water in your ear is going to be counterproductive. So, of course, being a Royal Marine Commando and having their trade, spending a lot of time, because they are, from what I've read and what I'm told, the world's most elite amphibious force. So they do have to do a lot of training underwater. So we've given the patient the following tips. Now, it may not always be feasible for them to wear earpieces or ear defenders, because they're going to be in communication with their comrades and superiors for instructions and commands that they need to undertake. So if that's the case, we've recommended the patient to apply some medical grade olive oil spray prior to entering the water. So it just adds another layer of oil to help protect the skin, repel water. So if it does enter, hopefully it will repel back out. Also advise them to use an acetic acid spray. The acetic acid will help replace any natural acidity that's lost. So as these oils that I described earlier are washed out of the ear, once they're leached out of the ear, to replace the acidity, so to help prevent the onset of a secondary ear infection, swimmer's ear, otalgia externa. We want to replace the acidity in the ear, so an acetic acid spray can help, which is essentially kind of a vinegar. And sometimes you can use, if there is excessive water in the ear, a 1 part alcohol, 1 part white vinegar solution. So it's almost similar to the acetic acid spray. But you also adding some rubbing alcohol. And I think the solution is 1 part of each. And what alcohol does, it binds with water molecules, and alcohol has got a much lower evaporation temperature point. So if you've got pure water in your ear, it will take a long time for the water to naturally evaporate, and in that time it can macerate the skin more, it can leach away more of the oils, it can just do more. The longer the water is in the ear, the more damage it's going to do. So alcohol, it combines with the water, and it homogenizes with the water, and it can then evaporate far quicker than water alone. So it dries out the ear quickly. If you get rubber alcohol on your hands, during COVID, we've all been obviously doing that a lot. A lot of people get irritation because it dries the skin. But of course, if you've got excessive water in your ear, that's what you want to do. Another solution is to use, there's a drops that we actually sell on our website. You'll see there, www.clearwax.co.uk. There's a drops that we sell, it's just to the UK, mind you, so just bear that in mind. It's called Clear Relief Drops, and that contains two main ingredients. It contains glycerol, and it also contains lidocaine. Now, glycerol works very similarly to the alcohol. It combines with water molecules to form an homogeneous solution. But glycerol also is quite an oily substance as well. So it absorbs the water, but it also helps to moisturize the skin afterwards because it's got this oily texture about it, a greasy property characteristic. So glycerol, it won't evaporate as quickly as the alcohol because the evaporation point's higher, but it absorbs the fluid, the water, excessive water out of the skin cells. So it helps to prevent the skin from macerating and an infection occurring. And the lidocaine is a topical anaesthetic, so a lot of dentists use lidocaine when they're performing their dental care. So if there is any pain, because of course if you've got swelling and inflammation in the ear, it can be painful, and the lidocaine just helps to numb the ear. It kind of masks the pain. It is short-term effect, but it can give some relief, hence the name, Clear Relief Drops. So there's some ideas there. If you're going to wear ear protection, there's different types of ear protection available. You can get custom swim plugs, which are probably, in some regards, the best option because they're custom made for the ear. They create a very tight seal, an airtight and watertight seal, so it's very difficult for water to get through. I would recommend, if you're using custom swim plugs, just to put a thin lacquer of Vaseline around the edge when inserting it, because they are by proxy meant to be very, very tight fitting, and they do have like a rubbery material to help, because it expands in the ear as the temperature rises to create even tighter seal. You can get different materials that the swim plugs are made of, but generally they're very rubbery, silicone based. So that sometimes it can graze the skin as you're putting it in and you're moving your jaw. So a bit of, even a squirt of olive oil around it, really. It just helps to lubricate it. And the oil will be a good thing again because it will, again, provide a hydrophobic barrier. So if the water is attempting to get in between the cracks between the mould and the ear canal, the olive oil can help repel that. So that's option one. You can get over-the-counter swim plugs. You can get these foam ones where you squash and put it in your ear, or some, again, silicone ones where you almost swivel in the ear. But again, the silicone swivel plugs, I think they can cause a bit of trauma to the ear canal because they're going to graze it. I prefer the foam ones, if anything, because you can squeeze it, put it in, and let it expand, and it's a softer material. It's not going to graze the skin of the ear canal. You can get silicone swim putty, so there's moldable putty you can get that you can try and put it in on the entrance of the ear, so you don't have to put it in. So some of the negatives of these swim plugs that I've just described, they are designed to go inside the ear canal. So if you are a wax sufferer and you're having to get your ears cleaned regularly, it can inadvertently push it further in. I had an interesting case today of a client who came from Birmingham. She's in extreme pain, and she wears swim plugs not only when she goes swimming, but also at night when she's in bed, so she doesn't get disturbed. And it was a very, very extreme impaction caused by these swim plugs. So the patient doesn't use cotton buds, but they just wear these sleep and swim plugs, and it pushed the wax right up against the eardrum. It was very painful for her upon attending, and she went yesterday to another clinic, tried to have it removed, but it was too uncomfortable. And prior to attending today, she took a couple of painkillers, some paracetamol, And we got it out for it. It was unfortunately just uncomfortable because it was already uncomfortable when she arrived, but we managed to get it out and it's just a lot better. But so I discussed the options with her today of how to protect the ear without trying to plug something in. So you've got these sprays, and if you do get water in, again, you can use 1 part rubbing alcohol, 1 part vinegar. I'm not sure if there's any ready-made solutions out there, or you can use ear calm, but that doesn't contain the alcohol to help absorb moisture, water, and cause it to evaporate. You can use the clear relief drops, which contains glycerol. So there are options there. Then you've got the various plugs, swim plugs, custom made over the counter, and then the silicone moldable ones. And with those, you can just try and put at the entrance and see if you can create a seal. Sometimes even cotton wool with a bit of Vaseline around it is going to be a good option. Just don't make sure you don't put it too deep in the ear. I've had it before where people try that and they put it too deep in the ear and they can't extract it. So just again, pat it at the entrance. Have a big piece, Vaseline around the ear. So these are all things you can do. Now, I know I haven't really talked much about the procedure, but as you can see, I've just removed in both ears a very large occluding skin plug, and I'm just peeling around the edge. This is their left ear. This is the worst ear out of the two. And actually, I performed this first when the patient arrived, but for the purposes of this video, I'm showing it second. This was more challenging than the first, and I'm not going to be able to remove every little last speck of skin. There will be some skin still remaining around medially. I just couldn't get access. The ear was really swollen. It may not look swollen when I'm in there, but I'm having to, so the bit that you yourselves can't see on the video is me externally, how I'm having to stretch the ear open. It's not visible. If I had an external camera, which I've previously done in the past, and I might just do it again so you can see what I'm doing on the outside, I'm using the endoscope almost like a crowbar. I'm stretching this patient's ear as wide as possible to allow me to insert the instrument. If I didn't stretch the ear open, like in the manner I am, I wouldn't be able to get the instrument in. And because it is swollen, particularly at the entrance, it reduces the freedom of movement with the instrument. So I'm more limited in what I can do. So then I have to resort to bending the tip of the fine end. I'm using the fine end sucker at the moment. And by bending it, I'm kind of creating my own angles. But if you overbend it, then the opposite side of the suction probe that I've bent, it protrudes in the opposite direction, and we've got to be careful that when we're then manipulating the wax like we are now, the opposite end where the kink is in the tube is not going to make contact. You can see I'm pulling it down, and I've just got to be wary that the sucker's not going to hit the opposite ear canal wall. You can see the eardrum, there is a bit of skin here. I think I'm going to leave a bit now. Well, I'm sure I'm going to get a bit more out because the videos, I'm looking at the time and there's another still about 4 minutes to play. So I'm just going to do as much as I can. When you're removing earwax or dead skin from the ear, if you're like myself, a right-handed person, I'm holding the instrument in my right hand, my dominant hand, because that's where all the precision is, because the ear cavity is less than a centimetre in circumference, and in some parts even narrower, and it's bends and kinks in there. You got the eardrum about 2.5-3 centimetres into the ear canal that can easily be perforated, and you've got the bony part of the ear canal, the inner teeth edge, which is very, very sensitive. Unless you're ambidextrous, you want to be doing this with your dominant hand for sure, because you need that fine motor control and precision. So I'm holding the instrument in my right hand. The endoscope, the eye clear scope, I'm holding in my left hand, which is my non-dominant hand. Now, of course, you still need good hand coordination with that, but it's the right hand for me, which is the critical one, because you can see I need full control there. So when you're a right-handed specialist performing the left ear and you're trying to remove wax on the left-hand side of the ear canal, the anterior canal wall, especially if it's bendy, that's the most challenging part. Because your hands almost have to, they don't cross over, but at a point when you insert an instrument, they do, and then you get it back, you realign it, and it is quite tricky skill. And the narrower the ear, the bendy the ear, the more difficult it is. So I'm just on the roof of the ear canal there. You can see I've managed to get access. I'm pulling this down, but as I'm pulling it down, I've got to be in full control of the sucker, because as you're pulling and teasing, you can overexert pressure on the suction tube, and it can fly off and make contact with other parts of the ear, which we don't want. This is really tricky. This is the inferior recess. There's a thick layer of skin. I'm just working at it, teasing it slowly away. I'll be honest, a few years ago, I probably wouldn't be as skilled as I am now to remove as much as I can. And it's like with anything we do, the more you do it, the more experience you get, the more confident you get, the more know-how you get, the more tricks and tips. So sometimes when we get a clear wax specialist that come on the course and they watch my videos before and then they come on the course, and sometimes they may be under a false sense of illusion that it's pretty straightforward, and then they realise actually it's not as easy as it looks. And it can be a bit disheartening for them. So I do just reassure them, like, you know, at one time I was like that, and it's part of the journey. So it does take time. It takes loads of procedures. You learn from your own mistakes. I'm always watching the videos back, obviously, because I'm narrating over it. So even I'm picking up little things that I could have done better, perhaps. When I speak to colleagues as well. So it's I'm still on my journey of improving. So if you are one of our clear wax specialists, practice makes perfect, or should I say practice puts you on the path towards perfection, which is probably never going to be attainable for any of us. But yeah, I'll be honest, I probably wouldn't have done as much as this a few years ago. So what I probably would have done is just referred the patient back to the GP and trying to treat this with pure medication. Now, we have written to the doctor because they do need some medication because of the inflammation. There's over-the-counter acetic acid, but I think this patient needs more. They probably have got a bit of bacteria in there, but more so the ear is inflamed, particularly at the entrance. So they need an anti-inflammatory, and that's as much as I could do. I think anything else would have just been too uncomfortable for the patient, too risky. Patient was over the moon. They wanted a copy of the video, which we airdropped to them. Their partner loves watching these videos. Well, take care, guys. Speak soon. Keep well.